One thing I stress about really any respiratory distress patient is both fear-free handling and stress-free handling. So there's a lot that we have to do with these guys in a short period of time. And we need to remember it's not just about getting these things done, it's that we have to give the patients breaks. So if we have the luxury of knowing a heart failure patient or respiratory distress patient is coming in, a lot of times we'll have the oxygen cage fired up, give them a shot of a furosemide or something if we think it's a heart failure, and just let them relax in oxygen for a minute. Take them out, maybe take our x-rays, put them back in oxygen, let them relax again, let them breathe some fresh air, get them back out, put in their IV. We kind of do it as this step-by-step process because they're in such a severely compromised state that the possibility exists of being too stressed out and going into a rest event. So we try very hard to make sure that, number one, we try to initiate treatments geared towards heart failure, get some therapies going immediately, but then let them relax. We can worry about all the diagnostics a little bit later on. We need to get them a little bit more stable. So handling a lot of these animals that are in normally fractious patients, they're so focused on breathing, they're actually much easier to work with when they're in this state. And a lot of these patients actually require very little restraint because they're just so focused on staying alive and breathing that a fair number of them will just let you do what you need to do to them, and you don't have to restrain them as you normally would. So that is a really important thing to remember, that they're in a severely compromised state, and over restraint, if they're already like a little bit of a stressed out patient, that just little bits of stress is enough to put them over the edge.